If you have severe jaw pain, or TMD, how do doctors figure out what's wrong? For decades, they just checked for bone damage, completely missing the reality of chronic pain. Say you have a loudly clicking jaw and intense pain every time you chew. Today, you'd enter a modern diagnostic flowchart called the Dual Axis System, or DCTMD. This protocol splits your evaluation into two distinct pathways to measure both mind and body. The first path maps your physical mechanics, and since basic panoramic x-rays are actually ineffective, doctors use clinical tests to measure jaw opening limits and exact muscle tenderness. This purely physical evaluation is called Axis 1. But here's the problem. Two patients with the exact same joint damage often feel totally different pain levels. Why? Because psychological distress actively amplifies physical chronic pain. So, the flowchart activates a second path to measure mental factors. It tracks depression, anxiety, and pain-related disability using specific scales. This psychological assessment is called Axis 2. Finally, both pathways merge into a single comprehensive patient profile. This dictates a personalized treatment plan instead of a generic physical fix. So what about that original patient with the clicking jaw? Their joint damage and their pain anxiety are finally mapped and treated together, fixing the entire system.